Ladies and gentlemen, friends with chronic hepatitis B infection, greetings from me, Dr. T.Y. Lok. I would like to share with you today my clinical experience and some thoughts on seeing patients with end-stage liver cirrhosis and liver cancer. Their days are numbered. There's not much to be done for them by the doctor. Powerless to help, my heart always sank on seeing such cases. I keep asking myself, why didn't they come earlier, before the onset of liver cirrhosis? I might be of some services to help them in gradual progression of the disease to liver cirrhosis. Something could be done to prevent liver cirrhosis and liver cancer. Is there a solution or a cure for chronic hepatitis B infection? My mission is to find a cure for the thousands of chronic hepatitis B carriers and patients. After conversation with the patient themselves or their relatives, I've come to the conclusion objectively that they are to be blamed to a certain extent for the tragedy. The misconception of chronic hepatitis B infection results in ignorance and disregard for the deadly disease. The most commonly found misconceptions are as follows. I am, quote, unquote, a healthy carrier. The results of the liver function tests are normal. Why should I worry? Second, I could coexist peacefully with the virus. Thirdly, there's no cure for chronic hepatitis B infection or carriers. So be it. Why should I worry? Why cross the bridge before you come to it? Such misconception stands in the way of effective prevention and proper treatment. In order to dispel the fallacies and clarify the misconception, I have over the years organized or sponsored free seminars on this subject. I've also sponsored free screening for hepatitis B and liver cancer. I've written books and a lot of articles for the papers and magazines in order to educate. I've done my best to help, and it's up to the chronic hepatitis B carriers to come forward and do something for themselves. They are solely responsible for the health and their life. With regard to their misconception, they should take note of the following facts in order to appreciate the seriousness of chronic hepatitis B infection. Fact number one, for those infected by hepatitis B virus, the incident rate of liver cancer for them is 99.9 folds higher than those not infected. How could the carrier be healthy and coexist peacefully with the virus under such a circumstance? Fact number two, 15% to 40% of the chronic hepatitis B carriers without symptoms will in their lifetime develop liver cirrhosis and liver cancer and even decompensation of the liver. This is a fact. So it will be very difficult for them to coexist peacefully with the virus. Fact number three, hepatitis B infection is a dynamic disease with the virus constantly evolving and causing liver fibrosis, liver cirrhosis, and liver cancer. So coexisting peacefully with the virus is groundless. Fact number four, chronic hepatitis B infection causes more than 800,000 deaths per year all over the world, mostly from the complication of liver cirrhosis, liver cancer, and decompensation of the liver. Fact number 5. Liver cancer ranks second among all the deadly cancers, according to WHO. Fact number 6. WHO is considering listing HBV as a carcinogen of the first degree in order to improve the dire situation of chronic hepatitis B infection. It's very important for those infected to adopt a drastic change of attitude and seek up-to-date and correct information in this regard in order to have effective prevention and proper treatment if there's any. With regard to finding a cure, I'm more than happy to announce or to state hereby that I've succeeded in using traditional Chinese medicine to induce endogenous cytokines to downregulate cccDNA, the replicative template of the virus located in the nucleus of the hepatocyte, leading to gradual reduction of the levels of HBsAg and final seroclearance. That's life-saving. If you wish to know more about that, please do not hesitate to contact me.